Welcome. As I mentioned, David Jordan with United Methodist Health Ministry Fund. I also serve as a member of Governor Kelly's Commission on Racial Equity and Justice. Thank you so much for joining us for today's webinar to review the Commission's report on local government recommendations. Today's webinar is the second of 3 webinars to highlight the Commission on Racial Equity and Justice's recommendations. Today's webinar will highlight local government recommendations included in our past reports. Last month, our webinar focused on legislative recommendations and can be found on the Health Fund's website, healthfund.org. We will send a recording of today's webinar out after the presentations. The final webinar in March will cover state administrative recommendations, and we hope you can join us for future conversations. First, I want to thank all of the commissioners who participated in this commission. I want to thank several of the commissioners who joined us today: Lawrence Public School Superintendent, Dr. Anthony Lewis, Dodge City Assistant City Manager, Ernesto De La Rosa, AFL-CIO President John Nave, Wyandotte County District Attorney, Mark Dupree, and Kansas Health Foundation President and CEO, Teresa Miller. I also want to thank Kate Davis, the Governor Kelly's Director of Regulatory Affairs, who has supported the commission over the last 18 months. I would also like to thank the Kansas League of Municipalities and the KU School of Public Affairs Administration, as well as the other co-sponsors who helped us spread the word about the event. Thank you all for your efforts. We know that to realize important change that are recommended in this report, it will take a collective effort and the hard work of everyone on this call and many others. Now, some housekeeping items before we get started. Given the large number of folks on this call, we had over 200 folks registered, so we're so excited. Thank you. Your calls are muted. However, we hope you use the chat function to engage through the webinar. Please feel free to introduce yourself in the chat function now. Also, I'd like to thank all of the local officials who joined us today. Please use chat to ask questions throughout. We will be monitoring the chat throughout the webinar, and we'll take questions at the conclusion of the webinar. We will also plan to use the raised hand function to call in folks later on in the webinar. However, we encourage you again to use the chat throughout. Before turning things over to Dr. Portillo, I just wanted to run through the agenda for the webinar. We're doing our welcome and introductions at this point. Dr. Portillo, Dr. Anderson, and I will review the report. We will have time for reflections from the other commissioners who joined us for the call. And then we're really excited to be joined by 3 wonderful reactors who serve in local government, both in staff and elected roles. Commissioner Ernesto De La Rosa, who participated in the commission and serves as the Assistant City Manager for Dodge City, will be providing a reaction, as well as Lisa Larson, who is a Lawrence City Commissioner and the former Mayor of Lawrence, as well as Sarah Lopez, who is a Sedgwick County Commissioner. Then we'll have time for questions and concluding remarks. Before turning things over to Dr. Portillo, I wanted to give an opportunity for the other commissioners on the call to introduce themselves if they want to. So Dr. Lewis, Mr. Nave, Ms. Miller, DA Dupree, or another commissioner who I may have missed, if you'd like to say hello. There's the space to do it now and as well as after the conclusion of the report.
At this Alliance, Kansas Interfaith Alliance rally, because I'm so pissed off. It was going on at Topeka. I gotta go.
Oh, I know.
And so I said, unfortunately, I'm not available.
I think we have a chat item that we need to mute someone.
In the meantime,
so Haley, that's on. If you can mute that person.
We will try to, oh, there we go. Great. Well, thank you to all the commissioners who joined us, and again, to everyone who joined us for today's call. We're so excited about the turnout and look forward to today's discussion as working well together. I'll turn things over to Dr. Portillo for the formal presentation. Thank you so much.
Thank you, Commissioner Jordan. As Commissioner Jordan mentioned, I'm Dr. Shannon Portillo. I was one of the co-chairs of the commission. I also currently serve as a county commissioner in Douglas County, so I'm very excited about our discussion of local government recommendations today. But first, I'm going to provide a bit of history and background on the commission overall. So Governor Laura Kelly signed Executive Order 2048 in June of 2020. forming the Governor's Commission on Racial Equity and Justice. Of course, in the summer of 2020, we saw uprisings around the country and calls for racial justice after the murder of George Floyd and Breonna Taylor, as well as a number of other calls for social justice. And the governor asked the commission to study issues of racial equity and justice across systems in Kansas. So this commission was not just meant to focus on criminal justice and criminal justice reform, but across multiple systems. We did start with a discussion around policing and law enforcement, but we included perspectives from a number of different disciplines across our state. So we included folks from the justice system, education, healthcare, and advocacy organizations. So again, this isn't just a commission on criminal justice reform, but really to focus across systems in the state of Kansas. And in order to do that in 2021, we really focused in on the social determinants of health with a specific focus on economic systems, education, and healthcare. In 2020, we submitted our first report to the governor, and that report focused specifically on criminal justice and law enforcement. That report included over 60 recommendations, and in both of our reports, we broke recommendations down into who had the authority and decision-making to really implement those recommendations. So we had recommendations specifically aimed at state agencies that administrators could put in place. We had recommendations for the legislature and things that we were asking for legal changes, and then recommendations specifically for local government. Our 2021 report followed that same kind of focus and flow, and there we had recommendations that focused on state agencies, the legislature, and local governments, but again with that focus on the social determinants of health. So we repeatedly heard in our 2021 learning sessions and discussions about overlapping and connected issues for communities of color across our state. And so we use the social determinants of health as a lens to really look across systems in the state of Kansas. We broke our commission into 3 subcommittees: an economic systems subcommittee, which I chaired, an education subcommittee, which Dr. Tiffany Anderson chaired, and a healthcare subcommittee that Commissioner David Jordan chaired. And we'll be sharing what we learned across all 3 of those subcommittees, as well as recommendations from our 2020 report as part of today's presentation. But I'll turn it over to Dr. Anderson to talk a bit about our process and timeline.
The process and timeline, thank you, Dr. Portilla, was broad but also deep in that the commission's work met every other week. The commissioners met from July 2020 through December 2021. We heard from state and national experts. We heard from local leaders, community members about topics important to Kansans. The meetings included learning sessions, presentations, and discussions. The commission took information from these meetings, and then we developed recommendations on improving racial equity for state agencies, the legislature, and local government. The commission also solicited feedback from Kansans via the social media. And so this very next screen lets you know all the different ways people could call us, they could email us, they could send a letter, or they could just go on any form of social media or Twitter and hashtag us as well. From that, we continued this work with really looking at our first report. That very first report includes 60 recommendations. It's for state agencies, it's for the legislature, and for local governments. These recommendations focus on law enforcement training, officer certification and standards, recruitment and retention and promotion, accountability, data collection, public defense, the justice system, school resource officers, tribal jurisdiction, immigration and law enforcement, behavioral health, and law enforcement funding. The Commission's 2021 report on the social determinants of health includes 90 recommendations. They're focused on the subcommittee subject areas of education, economics, and healthcare. Those include early childhood and child care, maximizing federal funding, tax policy, teacher diversity, post-secondary education, school resource officers and school mascots, maternal and child health, vaccine equity, universal equity policies, housing and homelessness, broadband, wages and lending practices, workforce, access to healthcare, family planning, behavioral health, ACEs and interfamily violence, and the juvenile justice system. So I'm going to turn it over to Dr. Portillo to talk a little bit more about the 2020 recommendations.
Thank you. As we mentioned, our 2020 recommendations really focused in on law enforcement and policing. And so a few of our initial local recommendations here include creating plans to recruit officers that reflect the communities being policed. So this is really ensuring that at that local level, we're reflecting our local communities in both police departments and sheriff's departments, including accountability measures and follow-up related to the enforcement of recommended changes. We heard from quite a few community members who said that we have discussions about reform quite often, but we need to make sure that there's accountability to follow through with reform. So making sure that we have that accountability in place in addition to training and policy changes. And then ensure that data collected is transparent, public, and easily accessible. We spend a lot of time in our discussions talking about the data and data-driven decision-making, but a big part of that is ensuring that the public has access to that and the public can help hold our institutions accountable. We also spent some time talking about hiring, and a big part of this is a recommendation to mandate review of records during the hiring process. Currently, hiring records are made available at the local level through CPost, but we recommend that all local governments be required to look at hiring records as a part of the hiring process for local law enforcement. And then providing incentive pay for officers who speak languages other than English, but including proficiency testing. We heard about a number of local law enforcement agencies that did provide this, and we think it's a great way to be really inclusive in making sure that there's direct service access for folks who are engaging with local law enforcement. And then we know that mental and behavioral health are connected with issues of law enforcement and connected with issues of crime reduction in communities. So we support the financing and use of mobile crisis response models, including co-responder units and virtual co-responder models to assist law enforcement. We need to make sure that we're not relying on law enforcement as that first line engagement when it comes to mental health crisis. And then also encourage law enforcement agencies to pursue available grant funding. We know that local government funding can often be strained, but there's a lot of federal funding for innovative changes like mobile health response and things like that. So we need to make sure that our local law enforcement agencies have the support and ability to go after that state and federal funding that can help support some of these changes and innovations. But I'll turn it back over to Commissioner Jordan to go through some of the local recommendations around healthcare in our current report.
2021 recommendations, as we prepare to talk about those, Commissioner Jordan will be talking about some of those recommendations as we go through this section. In that 2021 recommendation area, universal equity policies were one of the areas that we really tackled, and we looked at encouraging government policies and enact legislation that requires bias and equity analysis of policy decisions and legislation at all levels. Similar to the process of reviewing fiscal notes that inform policymakers about the financial impact of proposed legislation or requesting economic impact statements on relevant bills, the legislature should adopt a procedure for developing and considering equity analysis and impacts of any policy change. Also providing language interpretation and translation services so that all of Kansans can have access to their government. All government entities in the state really should take steps to ensure that meetings, offices, and all services are available to all of their constituents, regardless of their English language proficiency. This really should include translation of documents as well as live interpretation for meetings or conversations, including the American Sign Language. The next two areas really focus on maximizing that federal funding and making sure that I am still staying kind of within the slides that I'm to be speaking directly to. Commissioner Jordan, were these areas that you also were going to be speaking to so that I don't speak to something that you really wanted to speak to, sir? I'm going to continue from here on maximizing federal funding, considering the perspectives of people of color and people from groups impacted by COVID-19 in the process of distributing federal relief funds. As entities, we're recommending that we look at implementing direct relief and allocating discretionary funds. They really should create structures that bring people of color and communities that are disproportionately impacted by COVID-19 to the table. That's where decisions are being made, and we really feel that their perspectives need to be considered. Directing federal funds using a broad interpretation of health that includes social determinants of health and considering health equity, it's another area that we strongly feel needs greater attention. Significant funds from ARPA and other federal relief packages are directed to improving health outcomes. So Kansas should consider the definition of health to include aspects of the social determinants of health and allocate those funds accordingly. Additionally, health equity should be a primary consideration in the distribution of these funds. On this next slide, it really focuses on housing and homelessness, as well as broadband and the impacts to those communities and really all communities. We're recommending that we explore community land trusts as a path to making home ownership more accessible. So community land trusts, CLT, are not-for-profit entities. They're organized and they're run by community members that hold land in a trust for the benefit of the community. So under a CLT model, land may be used for community gardens, affordable housing, projects, parks, green spaces, and just many other initiatives. So through cooperative agreements, CLTs make home ownership achievable for individuals, and these people may not be able to purchase homes otherwise through the more standard means. Broadband is an area that I think impacts all of Kansas, and particularly school systems and other families. So we're recommending that we maintain a perspective that supports equity in the implementation of broadband development. State and local governments that are making investments in broadband should ensure that their work centers on equity and accessibility for underserved communities. Teacher diversity, which is near and dear to my heart, the area of flexibility is key. If we didn't know it before now, before COVID, we certainly know it now. So we're recommending that we provide flexibility to student-teacher programs for non-traditional students who must work and student teach. If you're not familiar with this, know that student teaching requires that candidates spend full days in schools for several months. This model was developed many years ago when most college students were traditional. Many of today's students, including the Grow Your Own candidates, are non-traditional. They attend college part-time because they are adult heads of households. They have one or more jobs, and they often have to care for children on their own. So remedies could include different models for student teaching experiences with more flexibility in scheduling and credit acquisition. The state could grant programs that districts can access to assist these individuals, and the state and districts should allow student teachers to receive work-study support. Districts should also create policies that support and protect diversity among students and teachers and staff. Districts should have clear policies addressing diversity, equity, and inclusion that contribute to an environment that provides the best educational experience for everyone. And the final slide that I'll be speaking to really is about school resource officers. If law enforcement is utilized in school districts for any purpose, districts should create sustainable partnerships and formalize MOUs between school districts, law enforcement agencies, and stakeholders. A formal agreement between the school district and law enforcement agencies developed in conversation with other stakeholders can help ensure clarity between various parties on the intention of engagement and the guidelines of law enforcement involvement in the educational institution. If we did that, this school to prison pipeline, we believe, would be impacted in a different way as we use resource officers differently and have those MOUs. So the juvenile justice system, the area that we really focused on were these zero tolerance policies. We believe they should be eliminated. Policies that promote alternatives to suspension for disciplines such as alternative schools, behavioral interventionists, family case managers, restorative justice programs. That's what we should be using. Students who are suspended or expelled are more likely to interact with the juvenile criminal justice system. And these disciplines disproportionately impact students of color. Alternative methods of discipline and treatment that allow students to still access education can truly provide a more productive response to behavioral issues. Turn it over to Commissioner Jordan to talk about maternal health and vaccine equity.
Thank you, Dr. Anderson. We certainly are covering a lot, and we're excited to have this conversation. From a maternal and child health standpoint, we made recommendations both to the state and to local governments to find ways to partner between local health departments, school districts, and Kansas Department of Health and Environment to support the use of evidence-based prenatal, postpartum, and parenting programs as a strategy to improve health outcomes and reduce disparities. We know that these investments made early in life benefit both parent and child, are critical to success in school, success in economic opportunity, and better health in the long term. From a vaccine equity standpoint, we know that county and city governments are working hard to make sure vaccines are distributed in an equitable way, not just the COVID vaccine, but a number of other vaccines, wellness vaccines. So we make the recommendation to utilize culturally competent messaging about vaccine efficacy and availability, making sure materials and communications are available in a variety of languages. And I think this also extends to outreach strategies to make sure that we are communicating effectively with the communities most directly impacted. Next slide, please. From a behavioral health standpoint, I think this touches on some of the comments made by Dr. Anderson and recommendations throughout the report, but the importance of building relationships between local government, law enforcement, and other entities to provide robust behavioral health services. It's really critical to explore opportunities to develop public-private partnerships between local government, law enforcement, healthcare, community-based organizations. Really, how can we utilize social workers, community health workers, patient navigators to make sure that we're reaching folks in community to address community health needs and preventing interaction with law enforcement, child welfare, and other crisis services? How can we make sure we're dealing with this in a preventive manner? And there's some really wonderful examples out there of this work being done in communities like Wichita and Pittsburgh that could be replicable. From an ACEs, an adverse childhood experiences standpoint and interfamily violence, just underscoring the importance of providing accessible screening of parents and children for behavioral health needs and developmental needs. Many of these services are delivered at the local level through local health departments, local FQHCs, or even school districts. So how can we make sure that there's payment through Medicaid, contracts, and other payment structures to promote and incentivize screenings? We know that if we can screen and identify problems, we can treat them and prevent more serious issues down the road. So we want to make sure both the screenings can take place and that there's payment models to support these services being delivered at a local level. Dr. Portillo, I don't know if there's anything else you would like to highlight from the economic standpoint.
I think a big piece of this at the local government level is really ensuring that we're advocating for resources at the state and federal level. So making sure that we're making our voices heard for pushing for federal funding to come to the state, but also making sure that we're hearing from the voices within our community as we're distributing funds at the local level. But I'm looking forward to hearing from our reactors and then the questions from our audience overall.
Excellent. Thank you so much, Dr. Portillo. Before turning things over to the reactors, do any of the other commissioners who were able to join us today want to offer any reflections on the recommendations included in the report as it relates to local government or the process that the commission undertook?
Thank you, Commissioner. This is District Attorney Mark Dupree, Wyandotte County. It was not only an honor and a pleasure to serve on this commission, but it was very fruitful. I met with our local commissioners concerning the things that we discussed, as well as the recommendations, and many of the things that we discussed and the information we received, we were able to apply here locally concerning criminal justice reform, accountability and local law enforcement, as well as housing and homelessness. There are some things that are very difficult to get pushed and passed when you're outside of local government. And as that process continues to be pushed, I think it's very important as we push our leaders locally to try to make it happen on a practical level. And every person that's on this call here, we're involved in some local something. And oftentimes this information never reaches the local ears of the folks who make the decisions. And so I would encourage everyone that's on this call to make sure that you take these recommendations and not only you personally apply them locally, but make sure that the leadership in your local community are aware of these different recommendations. There was a lot of work put in here, a lot of hours, a lot of experts came together. And so there's no need to reinvent the wheel. And so I would just really encourage you all to do what I have attempted to do and spread this information locally so that you can utilize it. And just as a way of kind of putting myself out there, I do not ever mind taking good ideas and adopting them as my own. Dr. Anderson, I know that you're in education. I don't plagiarize. I do cite appropriately, but I do steal all of the work. And so I think that we all should do that so that all of our colleagues, our citizens, and our community can benefit from it. Thank you.
Thank you, District Attorney Dupree. Any other commissioners have any thoughts or reflections?
Yeah, this is John Nate, Kansas FLCL, as also one of the commissioners. And I too recommend that we share this with a lot of the local level and tell everyone what these recommendations, all of it, can help those in those communities. A lot of good stuff was put into this, a lot of work, but more importantly, the people that came to the table and shared the ideas, and we a community engagement from the citizens all the way to the professional side that were brought in. And so please use what we've got here and take it and share that information so we can encourage, as we move higher as they move higher at the state level, to those elected officials to use these recommendations as along with legislation so we can get some of this stuff passed and into bill form. So, and of course, as everyone knows, that we are the commissioners, that we are available to share and talk and support all of these recommendations, of course. And it was just a pleasure working with everyone.
Thank you, Commissioner Nate.
Hi, this is Commissioner Anthony Lewis, Superintendent in Lawrence Public Schools. I would echo what my fellow commissioners have said earlier. Also, I want to thank Governor Kelly for acting so swiftly to establish this commission to do this critical and necessary work. And as I think back when Commissioner Portillo was talking about how long it's been, close to 2 years almost, when we began our work, we examined our current reality and just during this process, I really appreciate the multiple perspectives, the honest conversation, the expertise, not only that was on the commission, but also through the numerous guest presenters and the focus topics that we were all engaged in. There was a tremendous amount of research done to produce these reports. And so as Commissioner Dupree said, still, don't reinvent the wheel. It's a lot of good recommendations in here, but here's the thing: these recommendations can't just live on paper. We want to see these recommendations in actions. When I think about some of this work and the work that we need to do, we are not called to be masseuses when it comes to this. We are chiropractors so that we can straighten out the backbone of this state. And this is true transformational change. And when we think about transformational change, definitely in the vein of equity and I would say moving more toward justice, this is that persistent systemic change that some say disrupts. I prefer to use the term dismantle those historical legacies and assumptions and practices that we currently have in place. And so with all of our local leaders on today, it's really time for all of us to get in good trouble. Everyone on this call today, I appreciate you being here. And it may seem like we're preaching to the choir, but guess what? but the choir is the one that goes out and sings the good news. And so it's a goal for us as commissioners that this report will get us to a day in this state and really across the country where educational outcomes, our superintendent, where health outcomes, economic outcomes will no longer be predicated on race or marginalized identity. So I just really appreciate the opportunity to engage in this process.
Thank you, Dr. Lewis. And I think that's a good challenge to all of us to get into good trouble and come together to make this vision a reality. We have a hand raised from Commissioner Ernesto De La Rosa, and I think it also might be a good transition into reactor panel, though if one more chance if there's any other commissioners that want to offer any reflection that we may have done.
Thank you, David. Ernesto De La Rosa here. I'm the Assistant City Manager for the City of Dodge City, and I also had the pleasure to serve on this commission, and I thank all commissioners for their candidness and obviously the different perspectives in trying to move equity forward in our state. In this case, I represented Southwest Kansas. It's a humbling experience, and proud to be at the table and represent the voice of the immigrants and refugees from the side of the state, in this case, Dodge City. And really, I provided honest feedback and some of the things that I thought it was necessary to create change and to have a more equitable environment for all Kansans. But I would echo also comments from other commissioners on this call today is for us to advocate and to continue to utilize these recommendations or put forth these recommendations so that our communities become more welcoming, more equitable, and really make an impact in all really our residents and in particular, in this case, in Dodge City immigrants. And so thank you all for being here today, and be happy to also be available for any questions or clarifications you may have on the report.
Excellent. Thank you, Commissioner De La Rosa, and for your remarks in the first reactors panel. We have a couple other local government representatives, 2 elected officials. They can offer their perspective in hearing this for the first time. And I see a lot of great comments in the chat. So please continue to put comments in the chat or other questions here. And I think any of the commissioners are available to answer them, and we can get into a good discussion. With that, I'm going to turn things over for some reaction from Lisa Larson, who's a city commissioner in the city of Lawrence and a former mayor, and then she'll be followed by Sarah Lopez, Sedgwick County Commissioner. Commissioner Larson.
Thank you very much, David. I appreciate the opportunity to be here. As David said, I'm a city commissioner for the city of Lawrence. I've been on the commission for 6 years, and the work that is being done around equity, I feel as though we've really picked up the pace in the last couple of years. But first, I do want to thank the commission for the work that they've done on this subject. It is extremely important and very timely. For at least for the citizens of Lawrence, as well as I'm sure all others. And what I take away from this at this point in time is that this is a great opportunity for us to use the information that we are hearing from the commission, our equity programs. And when we get this type of leadership out of the state level, it just makes it much easier for us to transition that information and use it to make our community better. And so I'm very appreciative of the work that's being done. The recommendations that we'll be able to use for our community. From the policing aspect, City of Lawrence, we just did a very top to bottom study of our police department. And we came away with 60 findings and 75 recommendations of that, which we're trying to implement or in the process of implementing those recommendations through our, we just hired a new police chief, Chief Lockhart. And so these recommendations, along with the information that we received from this commission, is going to go a long ways to helping us make our community much more equitable. The information provided about the school resource officers, I thought that was really, really important for us because we do coordinate the school resource officers with the school district. And I think it's really important that the MOUs are very plain and clear and show some sort of guidance as to what we want to accomplish in that regard. So again, I just take away from this, this is a great tool for our community, and I'm really appreciative of the commission to do this and to have this type of leadership at the state level. It just makes it much easier for our job as a community leaders to segue into the equity that we need for our community.
Thank you so much, Commissioner Larson. Commissioner Lopez?
Thank you so much. Well, I'm going to reiterate some of what Commissioner Larson just said, and first by just thanking everybody who took the time to put this work in. I mean, this is just, it's critical work that needs to be talked about, and it needs to be done. And so I just can't thank you all enough for everything that you've done and the time you've taken. A lot of these conversations are hard to have. I mean, that's just the reality of it when we're talking about racial issues, especially. They're not always the most comfortable conversations to have. So thank you for being a part of that. In Sedgwick County, we are kind of doing similar things right now and have created a task force of community members that are looking at really our social justice system as it relates to mental health in the juvenile system is where we're starting. So I want to let you know that your work is going to absolutely be critical to what we're able to do. Just like you said a minute ago, I'm going to steal this. I'm going to give you all the credit because you guys deserve it, but I'm going to hand that off to our task force because we really are in a position that we're ready, both at the city and the county level, where we have the majority, both Republican and Democrat, on board to see these changes made. And so the work that you guys have put in over the last couple of years to look at all of these things is going to be just incredibly helpful to us going forward and really having that step to start on and not having to reinvent the wheel at ground zero. So thank you for that. This will be given to them next time they meet, which is next week. I also serve the National Association of Counties, NACO. They have a new president this year, and he has made DEI a very important piece of that. And so he created a brand new committee that works on just DEI work within the organization of NACO, but also to bring different things to different communities around the country. And so I hope that you guys don't mind, but I am sending all of this to them as well. So this will not just, your work will not just be seen here in Kansas, but it will be seen across the country. And hopefully we can see some of these changes that you guys have been a part of really help in so many more communities than just here in Kansas. So I hope you realize the impact that we'll have. And I just am so thankful for you. But a lot of this hits on some really important things personally to me. I mean, health is really where my passion is. So seeing all of the social determinants of health being, a leading driver here is just incredible. And it's so important. And I know we have across the country where racism has been considered or declared a public health crisis. And we have one space in Lawrence here that in Kansas that has declared that as well. So hopefully we can see that, continue and those things grow. But then my spouse is a teacher. He's been a teacher for many, many years, and now he is the teacher union president. So I'm hearing the work that you've done to really include schools and getting into these children's lives at a young age. I mean, that is really where we have to be starting these things because we can't not address that. So I met John Nave a couple of weeks ago, who was so excited to tell me about this work and who was bragging about all the incredible things that you guys were doing. And so thank you, John, for bringing this to me and passing this along. I really appreciate that. And so, I mean, I am always available if there is something beyond this conversation that you would like to speak directly about or give me more information on background or anything that you would like me to take to the task force or even to the national group that I'm associated with. However, I can be of assistance to the work you have already done. Please let me know. I'm always here. Thank you guys so much.
Thank you so much, Commissioner Lopez. And it's heartening to hear that there's already tangible uses for this group's report, because all the commissioners have put so much time in and the public input, which is where we got a lot of these great ideas from, were from having these, important discussions with community members. So we look forward to collaborating with you on that. I know Commissioner De La Rosa wanted to add a few more thoughts, so I'll give him the floor.
Thank you, David. I'll speak from my public servant hat now. And I assume you can hear me correctly. Can you hear me right? Okay, perfect. Sorry about that. No, really, as a assistant city manager in Dodge City, and from the local perspective, really one of the things that I do is work with our Cultural Relations Advisory Board. And some of these recommendations provided by this commission really triggered the conversation at the local level in Dodge City to start putting together and engaging the community on what we call a welcoming plan for Dodge City. And so really these recommendations fell in line with what we wanted to do and what we were seeing in our community, specifically relaying this to language access. It's very critical in our neck of the woods to make sure that not only in the very basic public services such as 911 communications, or in the healthcare industry, individuals or immigrants in Dodge City have language services, and so that they are able to address whatever issue they may have at hand. And as we know, sometimes in many different areas, language can be a barrier, and we wanted to make sure that those were available and able to help those individuals or residents in that manner. But really, this created a larger conversation in our community. We are kind of in the final stages of wrapping up a welcoming plan, which leads on to other different areas of the community, including healthcare and other policies that we could, as a community level, make change and improve the lives of our residents. And again, with the goal of continuing to move forward the equity piece and making sure that Dodge City, Fort County becomes a welcoming community. As you know, Dodge City, Fort County, it's one of the only 4 counties in the state of Kansas with majority Latino or Hispanic. And we need to recognize that, capitalize on it, but also making sure that we are meeting where the people are and addressing the challenges to better their lives. So really, this is helpful. And again, hopefully this is the start of the conversation for many of us.
Excellent. Thank you, Commissioner De La Rosa. And thank you for sharing the great work that you're doing in Dodge City. If folks have questions, put them in the chat or comments. I did see a number of sort of comments of thanking the report's recommendations and recognizing the importance of investing in early childhood and the important relationships there with families. I did want to flag for discussion, and I don't know if Dr. Anderson or Dr. Lewis and District Attorney Dupree have more thoughts on this, but just lifting up the collaboration by having MOUs between school districts, police, and the legal system, and how that recommendation came about, and any additional thoughts on that, because it seems like there's some interest in touching on that a little bit more.
Commissioner Jordan, absolutely. And then I'll turn it over to Dr. Lewis and District Attorney Dupree. But, to piggyback the District Attorney Dupree's comment about, replicating things that we see, I do want to mention that, as we talk about school to prison pipeline and SROs and SROUs, I do want to put a pin in that for a moment to also just remind everyone in this space. I think someone put it in here that, race is also a social determinant of health. And so as we're looking at communities and disparities and the redlining that still exists in various parts of Kansas, it looks exactly like it did 100 years ago. That can be interrupted or disrupted, depending on what word you want to use, but that can be changed and transformed. The Wyandotte model, some time ago, they have a model for homeless families. that Topeka replicated. And if you're in Topeka, a couple of weeks ago, there was a report that Topeka has reduced poverty by 40%. Which is now being known nationally. We just replicated what Wyandotte was doing because they decreased homelessness by 50%. I think there are many great things that are going on around the state of Kansas that we have to also highlight. And there are these pockets where we say, well, how did you do that? And what does that look like? And so both of those, the national and local coverage on the Topeka end with poverty is really systemic from just many people putting into this collective impact model, which takes us to this MOU for the police officers and for law enforcement. And so several years ago, right now, Topeka Public Schools is the only district in Shawnee County, but the MOU that we have is one where we really led in part by our chief of police in Topeka Public Schools, but also with TPD at the table and our legal attorney, our school board attorney. And we talked about 5-6 years ago, really about how do you ensure that we list the offenses that young people were previously being arrested for and incarcerated for, and remove and or reduce those, change those to just becoming offenses that are violent offenses. And so things like theft and other items that may be minor, really schools should not be a place in which that's an opportunity to engage with students in that way. So we ended up through the commission having some school resource officers, police officers. We had some national speakers through this commission that talked about school resource officers. We had a speaker on high poverty, high performing schools and what that looks like, as well as some administrators from other states. So really this commission, the CREJ, had an opportunity to look broadly and deeply at this topic. And so we're not saying you should or shouldn't have school resource officers, but we're saying if you have them, here are things that need to be occurring. I'll turn it over to Dr. Lewis. They have some pretty amazing models as well, just within their own school system, as well as District Attorney Dupree.
Yes, thank you, Commissioner Anderson. This is Commissioner Lewis, Lawrence Public Schools. It was very critical for us to really interrogate and look closely at what we were including in our MOU based on the current reality of what was happening in our schools and some things that we were hearing. And so as local agencies think about their MOUs, it's really critically important that we included things like training and having our SROs trained through NASRO, which is the National Association of School Resource Officers. Not only is it important to train the officers, but it's also important to train and provide the professional development to the school staff, administration, and teachers, because what we were hearing was that administrators and sometimes building staff were inappropriately using SROs as assistant principals, almost as disciplinarians, and that is certainly not the use or the correct use of SROs. And so really looking at that and putting that in the MOU. Not only that, we also included almost like a data sharing agreement where we would examine and look at the data that SROs were collecting in terms of who they're having interactions with, whether they're positive or interactions where they have to step in. And we wanted to look closely at race, gender of those students that they were having those interactions with. So those are some of the things that I think is really critical when you think about the MOUs with school districts and local police departments to include in there, and then constantly review that. Don't just have an MOU that you don't review for 5 or 6 years. Review those MOUs annually, looking at data, surveying your students, surveying your staff, surveying your parents to see how these things are going. Because what we don't want is just to put police officers in school without the proper training. And we really want our officers to be a value add to our students. And so some things we've done in Lawrence to that is just continuing to examine that. Our local police department has even, wrapped the cars at our schools. And so they'll have the mascot of the school on the cars at one high school and the mascot of the other school to kind of soften that police presence.
Mark Dupree, Wyandotte County District Attorney, and I'll tell you, just to piggyback on that, number one, the superintendents have really covered it all, but from the criminal justice side of this thing, and I think this kind of goes to, I think, Jasmine's inquiry in the chat, there's a lot of studies that are out there, right? And some are pro and some are con, but that's why these recommendations and the information that's in there are very vital and very important. We met and talked with a lot of those different folks on both sides, if you will, of the aisle, and you can find what you need with that information. What we did here in Wyandotte County concerning that, because we have in one district, we have a police department who deals with the school. The school has its own policing department, whereas others have an SRO who sends, officers from other departments and so on and so forth. So we have kind of a mixed thing going on here. What we have to do is first educate the officers, all SROs, all policing agencies, whoever is going to deal with our children, and making sure that they understand what their role and what their job is there in the school. And what their job is in the school should not be the same as their job out there on the streets. And that's a huge conversation, and really educating the individuals who are having contact with our children so that we can utilize them in the best way to assist in education rather than simply arresting individuals. And so once we figured all of that out, then coming to the meeting of the minds, when I was elected 6 years ago, what we found was there were outdated MOUs, as Superintendent Lewis just spoke about, and that many folks had not went back and looked at and utilized data and looked at what worked. So we first educated, then we put together an MOU that worked based off of the data and the information. And so I would encourage everyone to really focus in on what is necessary and then put that down in your MOU.
Thank you, District Attorney Dupree. Any more comments on the school resource officer question?
Jordan, I see there's a question about some of the data that was used, and the question was, thank you, Jasmine, regarding just what data reports are out there that indicate school resource officers in schools are linked to any kind of decrease in the school to prison pipeline, and how are students used in the MOU. And I suspect every school uses MOUs and how they use students differently. But let me start with the first. It wasn't the who, it's the how. So it doesn't matter who you use. If you're using a principal, school resource officer, a liaison, a counselor, a social worker, we found that models like restorative justice models, as one example, and other models, implicit bias training, those things were critical no matter who you put in place. And in our one of our meetings, which was videoed, and it's also on the website that was posted, we did have a demographics person there that really showed nationally arrest records. That's something from the Office of Civil Rights and Justice that's kept for districts and states. And so he did share some of that data and shows that there's not a high correlation between school resource officers and arrests necessarily. But what we do know, though, there is a high correlation between choosing not to arrest young people in school as the place in which you identify where young people are. And so we really talked about programs and processes. So I thank you for bringing that piece up in that regard. In terms of how students are used, I know I'll just speak for Topeka, and I'm sure Dr. Lewis also has a variety of student groups that contribute and give feedback in different ways to different systems. What that looks like as it relates to the MOU, I'm sure changes, but our process is to use student feedback and then be the representatives to bring that to the table. For me, I have a student advisory group in Topeka. Hopefully that answers the question. Someone sent me a little email outside of this regarding the article on the poverty. So I'm just going to put it in the chat regarding the article from a week or two ago of the 40% drop in poverty rates.
This is Commissioner Lewis, and I would just add to that. I think it's critically important that you do include students in the MOU, include students in the annual evaluation. Those are the individuals that are in the hallways or in the buildings with those students. With the SROs each and every day. And in the vein of training, it's also important that the SROs get the same training that your classroom teachers get. And so, for example, we utilize Courageous Conversations About Race, Glenn Singleton's work, Pacific Education Group, and our SROs have gone through that same training as well. As superintendent, I've gone out and purposely had focus group conversations with students, a diverse group of students, and asked them, their lived experiences with SROs. And I will never forget that it was this one student of color that shared with me that I called. He didn't call the police officer by officer. He called her affectionately by auntie. And so that spoke to the tremendous amount of work that that officer has done in terms of establishing and building those relationships with students.
Thank you, Dr. Lewis. I saw a question in the chat from Rebecca Gaston about data analysis, particularly in public benefits programs. One item that I'd like to lift up is included in the recommendations, and Dr. Anderson covered this earlier, both for state and local governments, we recommend an equity impact analysis of different policies, similar to fiscal analysis that goes through. And I think that's an important thing that local governments can do. We did talk a lot about data as part of this work. And Dr. Portillo, I don't know if you want to touch on any data that you might be able to suggest or firms to help analyze some of this, but I know you dug into the data a lot.
We did spend a lot of time discussing data, and I'm sorry I don't have any specific recommendations for data experts to assist with kind of public benefits programs. So I will say that the Institute for Policy and Social Research, IPSR at KU, Donna Ginther has done quite a bit of work around economics in our state and some of the public benefits programs. So I guess I will say that there's an expert. We relied on Dr. Ginther quite a bit throughout our commission's work around some of the issues around the economic climate in the state, and she's done some great work around public benefits programs. But a big part of what we did was really encourage data collection and data transparency at the local level. And so a lot of this has to do with, as we make these recommendations and as we move forward, making sure that we're collecting data and keeping ourselves accountable, whether we're talking about reforms in schools, whether we're talking about reforms in local governments, and then how we can think about some of those state programs. A big part of what was part of our recommendations in the legislative webinar, which we did last month, was really showing that some of the policies that Kansas has put in place that restrict access to public benefits really hurt us in the long run when it comes to the overall economic vitality of the state. And so that's something not necessarily for local governments to take a look at, but our legislature to take a look at. From the local government level, really the focus is around collecting data and making it transparent and accessible to our communities.
Excellent. Thank you, Dr. Portillo. We might have time for one more question. And along those lines, just this week, I had seen a really exciting analysis done by the Minnesota Medicaid director that looked at structural racism within the state's Medicaid program and how they might be able to tackle it. And it was really courageous of them to take that deep of a look as an agency and to look at how the program was racist from a structural standpoint. So I think that there's a lot to think about from a state administrative standpoint, which we'll be talking about next month. So I know we're excited about that webinar. Any final questions? Well, with that, thank you all for joining us for this great discussion. It's wonderful to see the exciting energy in the chat and the questions. And thank you to all the commissioners for participating, for their leadership, for their time, and to our reactors. Thank you so much for joining us today and for the work that you're already doing with this report and the work that you do every day. Thanks to everybody, and have a wonderful day. We hope to see you in March for our final installment focused on state administrative policy recommendations. And we'll be sending out the recording of this webinar and a link after we conclude today. Thank you so much and have a great day.